Hi, I'm Michael Herrick, and if you work at a small medical practice or specialty clinic, or if you own one, especially here in Albuquerque, I'd like to talk to you about one of the biggest challenges facing healthcare today: patient privacy, data security, and HIPAA compliance. Just glance at the news to see what a big issue this is. Every day there's a new headline about a big company suffering a big data breach, people's confidential information being exposed, servers and databases being hacked. It's affecting big companies like Target and Home Depot, even the United States federal government. In healthcare, you've all heard about the Anthem data breach. It's been affecting hospitals as well, including hospitals right here in New Mexico. Hospitals in Las Cruces and Las Vegas have been victims of data breaches of healthcare data. It's also affecting small companies, small medical practices, and it's not always a big, exciting, Mission Impossible style cyber attack. It can be as boring as a doctor leaving a mobile phone behind in a restaurant. It can be a smash and grab where a thief takes the laptop out of the backseat of your car. Or maybe you've got employees or maybe even providers who are sending unencrypted emails full of patient data, full of names and birth dates and diagnosis codes. All of these things can create serious data breaches, seriously compromise the security and privacy of your patient's confidential information. And of course, it can create huge financial liabilities for your small medical practice. To just take an example, there's a practice in Massachusetts that recently lost a flash drive containing patient data. It wasn't stolen, it was just lost. But now this 12-physician practice is on the hook for a $120,000 fine to the Department of Health and Human Services. Or closer to home in Phoenix, some cardiac surgeons are facing a $100,000 fine because their staff was using Google Calendars to schedule patient appointments. Now, it's one thing if you're a big hospital or a big organization and you've got the staff and the money to deal with these kinds of issues, but what about the small practice, the small business? Because that's what a small medical practice is. It's a small business, and it's getting harder and harder to run a small business today. I've talked to a number of providers who tell me that they're going to just figure out a way to retire early because they can't see how they're going to deal with all of these new challenges that are facing healthcare. Now, I hate hearing things like that because I love small business. I've owned my small business since 1992, and I've spent my entire career helping small businesses, helping them deal with difficult challenges and stay competitive. So if you're running a small medical practice, a small business, and these issues of patient privacy and HIPAA compliance are concerning you, I can help you navigate those issues and feel confident that you're doing the right thing to protect patient privacy. Because that's what makes this so scary and so unsettling, is when you don't know where you stand. Now, you're working with experts, you've got your EHR vendor, you've got your IT company and people like that, and you're pretty sure they're all doing the right thing, but then you'll see an article about encryption, and you'll ask, am I supposed to be doing that? Or you'll call up one of your vendors and you'll ask if they'll sign a HIPAA business associate agreement, and they look at you like you got two heads. And whatever the details are, whatever it is that you're supposed to be doing, you know that you don't have a single strategy pulling it all together. You're dealing with these things piecemeal as they come to your attention, but you're having a hard time getting your head around the big picture. So you just cross your fingers and you hope that everything keeps working and nothing goes wrong, because you really don't know what you would say if you had to talk to an auditor someday. Now, that's scary, audits and hackers and fines, but I want you to know that my team and I, we're not about scare tactics. You've already got enough on your plate, you're already feeling overwhelmed, and we don't want to add to that, we want to lift that. We want to show you how you can deal with HIPAA and with patient privacy. We want you to feel like you've got a handle on this, like you've got a plan. You can't do everything at once, but we can show you how to get started, how you can keep improving, and how you can do it strategically, which also means affordably. I'd like to share some information with you about your very first step for HIPAA compliance, and that's a thorough risk assessment. You can use the link or the form on this page to request that information. Now, a risk assessment is required by HIPAA, and it's required by meaningful use. Those big fines that I talked about earlier, $100,000, lost flash drives, the reason those fines were as big as they were is because those practices not only suffered a breach of healthcare data, they also had failed to conduct any kind of risk assessment beforehand. And if you're like 70% of the medical practices that were reviewed by Health and Human Services, you haven't done one either, or you don't have one that's up to date and up to snuff. So use the link or the form below, and we'll send you some information about what makes for an effective risk assessment. And I can tell you one thing right now. Risk assessment is a lot more than just a checklist. You're not going to print out all of the HIPAA specifications and go down the list, yes, no, yes, no. That's not going to work. But get this information from us, and we'll show you what will work to make an effective risk assessment for your small medical practice. You can also contact us anytime if you just want to start talking about your specific needs and what you need to do for your small medical practice. You can reach me anytime at 505-750-3531 or with the email address on this page. Get in touch and we can get you started right away on a risk management plan that's right for your practice. I'm Michael Herrick, our company is Matterform, and we're in downtown Albuquerque. I'm glad you found us, and I hope to talk to you soon.